Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. I'm happy and grateful for everyone who have shown up to see me presenting my topic today. Before we start our presentation, allow me to introduce myself. My name is Putri Novita Ningrum. My number is 3110200063 and I am from Faculty of Dentistry, Sultan Agung Islamic University. And I'm here to presenting about benefit of a toothbrush with fluoride toothpaste. Okay, next, let me introduce about fluoride. What is fluoride and why fluoride is important? Fluoride is one of the most abundant elements found in nature. Water is the main food source of fluoride. The only known association with low fluoride intake is the risk of dental caries. Initially, fluoride was thought to be beneficial when administered systemically during tooth development, but subsequent studies demonstrate the importance and benefit of its topical effect in the prevention of or treatment of dental caries and tooth decay. Next, let me know about toothpaste. Everyone know people use toothpaste with toothbrush to gently sweep away plaque and other debris from the teeth. And all toothpaste share some common ingredients that research, like abrasives such as calcium carbonate or calcium phosphate. Theirs remove anything sticking to the surface of the teeth without shredding them. Binder like sodium alginate or santan gum. These provide elasticity and form to the toothpaste and help prevent it from drying out by bending water to it. And hermitage such as glycerol or propylene glycol, these retain water to prevent hardening of the toothpaste. Next about recommendation of fluoride toothpaste. Proper use of fluoride toothpaste varies by the child age according to AAP. AAP is American Academy of Pediatrics. Number 1. For children under 3 years old, brush with a smear of toothpaste. To minimize the risk of swallowing, angle the baby head slightly downward so that any extra toothpaste can dribble out of the mouth. And number 2, for children aged 3 to 6, apply no more than a pea-sized amount of toothpaste to them. To reduce the risk swallowing, encourage the child to spread out the residue rather than rinsing with water. Next about myth or fact, fluoride. We talk about myth first. Number 1, fluoride toothpaste can be toxic. When will the fact the amount of fluoride allowed in toothpaste is strictly regulated. We have to eat a tubful of toothpaste to even get a symptom of fluoride poisoning. In other words, having to eat 6 tubs at the time for fluoride to be life-threatening. 2. Myth. Fluoride in drinking water or toothpaste can cause cancer. When well fact, research has shown that the amount of the fluoride which is at the toothpaste does not raise the risk of cancer. Next, About benefit of fluoride. A good balance between the remediation and demineralization process will lead to hair life and stronger enamel tissues. However, if the remediation process can keep up with the demineralization process carries with form. And one of benefit of fluoride is that it favors remediation and can contribute to the prevention of caries. Next, last but conclusion. By knowing how to brush your teeth properly, you can get the benefit of toothbrush that contain fluoride. Healthy teeth are teeth that are neat, clean, shiny, and supported by healthy gum, of course. The gums are hard and pink. To achieve optimal dental and oral health, regular maintenance must be carried out down, and so that the condition of the teeth and oral tissue remaining healthy.
So then, why?
This can be achieved by check your dental and oral health to the dentist every 6 months, and not only if there is one complaint. Okay, thank you. That's all for our presentation today, and thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.